Hi, I'm Paul Fahey, Vice President with Smith & Jones. We're a marketing communications firm located here in upstate New York, servicing clients throughout the Northeast and East Coast. Thanks for joining us. And in particular today, we wanted to speak with you briefly about vaccination mandates and how history is on your side. And in particular, want to deliver this and speak to the impact that the vaccine mandates have on your hospital's brand. This is part of our annual Trends Report series and really just bringing news that we think you can use in your daily lives as marketers. So let's get right to it.
Good evening, and thank you so much for joining us. We're going to begin with an alarming surge in new COVID infections in the U.S. For the first time in 2 months, the country is again averaging more than 100,000 new cases per day. More than 1,100 Americans are dying each day from COVID, and nearly 50,000 are being treated in hospitals. While the Delta variant remains the dominant strain of the coronavirus, the new Omicron variant is also spreading rapidly. Cases have now been detected in at least 18 states, but scientists still aren't sure if it is more dangerous than previous variants. And scientists in South Africa, where Omicron was first detected, say that symptoms in most cases have been mild. Well, the mayor of New York City today announced one of the nation's toughest COVID vaccination mandates in the country, forcing all private businesses to require their workers to get their shots by December 27th. That's actually 3 weeks from now. CBS's Nikki Batiste is going to lead off our coverage tonight in New York with all those details. Good evening, Nikki.
Nora, good evening. Not only is it one of the toughest mandates in the country, New York is now believed to be the first city to require vaccines for all workers. And now children here as young as 5 must be vaccinated before any indoor dining or entertainment. The New York mayor today called his mandate requiring all private workers be fully vaccinated a preemptive strike against the cold weather and the new Omicron variant.
Look, this is how we put health and safety first, by ensuring that there is a vaccine mandate that reaches everyone universally in the private sector.
Okay, and we're talking about some of the toughest vaccination mandate policies that are in the country. And in response to tough vaccination mandates, we'll often hear phrases like we're seeing here: a conflict between intelligence and ignorance, civilization and barbarism, the greatest crime of the age, and something that could perhaps lead to the slaughter of tens of thousands of innocent children. No doubt, the kind of conversations we're hearing often on social media and we're hearing in relation to today's vaccination mandates. But would you be surprised to know that these were quotes that were founded in 1901? And they were founded and given and offered in response to the smallpox vaccinations mandates that were happening in Cambridge, Massachusetts. So let's take a look at smallpox for a second, because I think in stark contrast to COVID, this is a pretty dramatic disease. Many of us are not familiar with it. None of us have lived, most of us have not lived our life having smallpox on the planet. And it's a pretty devastating illness with far greater mortality rate than COVID. COVID looking at about a 1.9% mortality rate, smallpox more than 30%. Extremely contagious, perhaps one of the most contagious viruses on the planet. And for those people that did survive, a lifetime of scarring, blindness, and a lot of other afflictions. So why such a heated response to something that is far more devastating than COVID, and why are we paralleling some of those responses today? It's a fair amount of what we'll talk about. So as I mentioned, 1901, deadly smallpox epidemic tearing through the Northeast, and in particular Boston and a suburb of Boston, Cambridge, Massachusetts, was really in a full-fledged smallpox panic. 1,600 confirmed cases early on, 500 deaths that were already hitting the books. The city ordered the closure of a lot of the public places, a lot of the same responses and policies that we're seeing today to stem the spread of the disease. And in response to that, non-compliance was met with a $5 fine. So the boards of health had said, not only do we need to close these facilities, but also we have vaccination mandates of all residents. There's an example for $49. I think on eBay you can actually purchase a authentic smallpox vaccination needle. For whatever that information is worth. So they literally went door to door or to other venues administering these vaccinations for smallpox. Police officers were accompanying people given some of the volatility of this. And not surprising then and now, many people were refusing to get the shot, claiming that this violated their personal liberties offered under the United States Constitution. And The fine for that was $5 at the time, adjusted for inflation. It's about $150 today. And over on the slide here, we also have a certificate of the protection from smallpox, also available on eBay as far as I can remember. So this issue was as hot then about vaccination mandates as it is now, and how that relates to hospital brands and marketing we'll get to in a moment, but indulge me a little bit more background. So Swedish-born pastor named Henning Jacobson took his anti-vaccination crusade all the way to the U.S. Supreme Court. He was one of the early objectors to this, refused to get the vaccination for this. And at the time, the nation's top judges in 1905 ruled that they legitimized the authority of the states to, quote, reasonably infringe upon personal freedoms during a public health crisis by issuing a fine to those who refused vaccination. Justice John Marshall Harlan acknowledged the fundamental importance of personal freedom, but also recognized that, quote, the rights of the individual in respect of his liberty may at times, under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulations as the safety of the general public may demand. And this decision established what became known as the Reasonableist Test. And that certainly was something that set legal precedent at the time, but it's actually something that I think many organizations are doing themselves, whether it's based in logic regarding public health or the law itself. I think many healthcare organizations and their leadership teams are basically saying, what do we think is reasonable? What do we think is rooted in science? And what is it that our patients and the public is looking from us as healthcare institutions? So with that in mind, let's fast forward to 2020. The Supreme Court ruling on COVID pandemic lockdown orders. So early in 2020, there were a number of different lockdowns. Now, this is pre-vaccination. A number of different municipalities were ordering lockdowns of public gatherings, public venues, citing the COVID-19 pandemic. And early on, a lot of judges justified those restrictions by citing Jacobson v. Massachusetts, which was the 1905 court case, since it was actually at the time the most recent Supreme Court ruling that explicitly addressed state powers during a disease epidemic, even if it was 115 years old. So, are we settled? Is that, and that's actually a legal term, has this issue been settled? Does it ever need to come before the Supreme Court again? You might think so. The Supreme Court did, in a reversal, rule that in 2020 against broadly applying the logic of Jacobson to all COVID-19 lockdown restrictions. So there was a case here in New York State, Roman Catholic Diocese of Brooklyn versus New York Governor then Andrew Cuomo, citing that this issue violated the constitutional rights of citizens wanting to safely gather in churches and synagogues during the pandemic. The lockdown laws barred religious gatherings altogether while allowing secular businesses to operate at a limited capacity. And so while Jacobson v. Massachusetts still holds a significant amount of water with regard to vaccination mandates, the issue at hand here was basically the churches and synagogues saying that they were being unfairly criticized or penalized compared to private businesses. So while we believe and certainly support Jacobson v. Massachusetts outcome, it's important to keep in mind that it can't be broadly applied in all circumstances, that we do need to take into consideration consistency in all areas. Now, with that in mind, we still find ourselves amid a lot of protests. There are a lot of staff walking out and people that are boycotting institutions in general because of the vaccination mandates. We at Smith & Jones believe that history is on your side. We know a lot of our clients, colleagues of ours, friends of ours, in leadership roles are rolling out vaccination mandates at your hospitals and health systems. We encourage you to stay the course. Apply your own reasonableist test to this problem. You know that we pursued careers in healthcare to serve people who are vulnerable and suffering. Everything else that we do has to be done in support of that goal. And we believe, like you do, many of you do, that COVID-19 vaccination helps us do that safely and effectively and allows all of us to move past this pandemic. Listen, to the people, listen to the people on your staff, listen to the people in the public, learn from your experiences, learn from your peers and colleagues, roll out these policies over time in an organized way, be ready to accept the criticism you're going to receive from the public, the controversy, the demonstrations, but know in your heart of hearts, and we fully support that you are doing the right thing in asking that your employees and encouraging the public to be vaccinated against the COVID-19 virus. Because, and this is how it relates to marketing communications, we believe that consumer confidence is the bedrock foundation of your brand. Your brand is built on consumer trust. Folks are coming to your institution ill, injured, off balance, emotionally afraid of what's ahead. And the last thing they want to do is have your staff add to that by worrying and wondering if they're going to contract COVID from somebody within your institution. It's that sense of trust that we think will help preserve brand equities as you're moving forward, especially at times when institutions have their policies they've elected to suspend, or they've suspended elective procedures within their organization. So on behalf of all of us at Smith & Jones, thank you very much for carrying that water, for leading the charge, for helping us all move past that. Thank you for building strong, robust organizations that are based on consumer trust. And with that, we wish you the best of luck in the future. Thank you.